welcome. Welcome to Dr. G Pediatrics, or Ask Dr. G. And again, this channel is suited for parents or caregivers who want to know why the pediatricians do what we do. And I like to answer questions and provide tips and tricks and just kind of going inside that pediatric brain of why we do what we do. So one of the more common questions that I am seeing right now, since the norovirus has been circulating, is that their child has a stomach virus, which is one of the more common ones is a norovirus, but that stomach virus is kind of the term that we use. The fancy doctor name is viral gastroenteritis, which is usually viral. The question that I received, though, is, Dr. G, should I give my child the BRAT diet? So for those of you who may not be familiar with what the BRAT diet is, it stands for bananas, rice, applesauce, and toast. And so to answer that, I'll say no. And it's not because the BRAT diet is totally wrong or totally bad. There are some components to it that's actually great, and I'll go into that in a little bit, but the BRAT diet is pretty restrictive. And so when we think about a child who has irritation or inflammation that's going on in their stomach and their intestines based off of most likely a virus germ, then we really want to initially focus on making sure they're drinking enough to not get dehydrated, right? And so of course I'm talking about your toddler and up age group, not talking about the infants. This is more so catered towards an actual child who can consume the BRAT diet. If you're less than 12 months, you really shouldn't be doing that just yet. So the first step is to establish if your child is dehydrated. Ways you can do that to assess that. One of the key things for us is whether or not your child is urinating like normally, okay? Are they making the normal amount of wet diapers? Are they urinating and voiding as normal? That's a great check for us. Also, another way you can do is check their inside of their mouths. Does it seem like it's moist? Can you see the saliva? If they cry, are they still making tears? These are all great signs that the child is not dehydrated. If you're noticing a slight slowdown in their urine output, or that though they have a little bit of saliva in the mouth, it's not like they're normal, then that's where the focus is going to be on making sure they are drinking enough to where they don't get dehydrated, because usually you'll have the vomiting and then you'll have the diarrhea. So I know I'm like getting off of the point of the BRAT diet, but I'm going to come back to it. I just want to assess this first. Okay, so if you are checking your child, okay, they're maybe a little bit dehydrated or mildly dehydrated, you want to give them what we call or ORS, which is oral rehydration solution. Widely known, Pedialyte is one of the more commercial products that's straight up. You don't have to dilute it. You don't do anything to it, but it does give the child, you're replenishing back their fluids, their body salts, aka electrolytes, and sugar as well. But it's not too much sugar to cause more problems. So you really want to focus on that at the beginning of the stomach virus stage. And it can be something as small as giving them a teaspoon every 1 to 2 minutes, or giving them 5 milliliters in a syringe, a medicine syringe every 1 to 2 minutes, just to make sure they can keep that down. So fast forward to the stage that the child is able to keep the fluids down, they're not dehydrated. Now we're thinking about giving them food and calories to replenish some of the losses that they've had. So the BRAT diet, again, it's something that we used to recommend a while ago, but realize it's too restrictive, because if a child is at a point where they are able to keep their fluids down, they're not dehydrated, we really want to try to get them back to eating kind of a very close to normal diet to give them the nutrients and the calories that they need. So What you want to focus on are complex carbohydrates to give your child. So that's going to include rice, bread, pastas, whole grains, which again, in theory, is the toast part of the BRAT. But you also can incorporate some lean meats, so turkey, poultry, fish. If you're vegan, tofu, beans, those are lean proteins that can be given to a child at this point. And then the other part is giving them fresh fruits and fresh vegetables. So those are all okay. What we don't want to give during this time are we don't want to give sugary or sweetened beverages. So Sprite, flat, ginger ale, juices, those are not recommended because what they can do is actually kind of worsen the diarrhea a little bit. It kind of just makes them go a little bit more. So we want to stay clear of beverages that are high in sugar. The other thing is that we don't want to give them foods that are high in fats. So foods that are fried, very oily, very greasy, the fun foods for a lot of kids, it's just too much on their stomach and their intestines at this point, and it's more likely to cause more irritation. So, pizza, not great, chicken nuggets, french fries, McDonald's, hamburgers, all those things theoretically are not the most healthiest anyway, but we definitely don't want to do that at this point. So if you have a child who feels that they're recovering and then they get ready to eat, first meal shouldn't probably be a Happy Meal or some pizza. We really want to give them foods, of course, is when they can tolerate it, but we don't want to do it with foods that can be offensive to their healing gut. So the BRAT, no, but the BRAT's not wrong. It's just there's other things that you could also give. So I hope you found this helpful. If you did, please subscribe. Until next time, stay awesome and be great. Bye.